Hey, Tiffany here. Knowledge is power. One thing that you didn't know about plant medicines and the medication that you may be taking. Um, it is not recommended to take plant medicines. Remember an umbrella term. We work with one that starts with a D, ends with a T. Not really sure what I can say, right? Because we're not trying to get thrown off of these platforms. Um, Plant medicine interactions, umbrella term, this includes most that you would be taking plant medicine interactions with antidepressants. What a lot of people don't understand when they are taking plant medicines, umbrella term, anything that you are taking that induces non-ordinary states of consciousness, the when you are on an antidepressant, the antidepressant, in particular SSRIs are you are low in the brain on the production of serotonin. And so what an SSRI does, your antidepressant, what it does is it blocks the reuptake of serotonin in the brain. So it's just saying that it's not taking the serotonin out of the brain, it's keeping it in the brain so it can be more likely to bind to the receptors. So it's almost like it's trying to flood your brain with serotonin or what little is there. So it's keeping it there. Plant medicines increase the production of serotonin in your brain. So there's even more floating around as you're doing the journey. So the interaction between plant medicines and the serotonin in your brain and the antidepressant is that there is a potential for serotonin syndrome to happen. Serotonin syndrome, again, is having too much serotonin in the brain and it not being able to go anywhere. It's just there. Mild symptoms at the least, let me look here: restlessness, agitation, sweating, shivering. At the most severe is the loss of consciousness, seizures, high fever. It is recommended that if you are taking plant medicines, you are not on an antidepressant. The interactions don't go well. Do people do it in an unintentional way? Absolutely, but they usually don't know that there is a negative interaction that has the potential to happen. And it's like taking any type of medication, right? The severe symptoms at the worst sometimes don't outweigh the lesser symptoms, but nobody wants to take a chance on that. It's just not worth it. Knowledge is power, right? So this was not scheduled content, just something that was floating in my brain right now. But if you like this content, because there is going to be a lot more of it, like and follow our page. Go to the link in bio. There is a free guide that you can download, Journey to the Soul, Understanding Plant Medicines, and it's very informative, very informational. DM us if you have more questions. Put a comment in this post about maybe the interactions you've seen, your personal use, whatever it is. I am not a medical provider, just as an FYI. Like, I am a licensed mental health provider. I do not deal with the prescribing of medications. I just have very general knowledge based on my education. Okay, like, comment, follow. Have a good day.